In my 23 years of practice, I've seen many of the people who come after a fall with an injury to the knee. That injury sometimes will be a devastating. It could be a small minor injury to the cartilage, or it could be a big injury to the inside the ligament. The ligament injury is the one which is very important to get addressed properly. In India, apart from the sports, I've seen a lot of people, they come following a fall from a two-wheeler, especially the bicycle or the two-wheeler, the biking. The ligament gets tear after a fall, which if gets unnoticed can injure the cartilage. Thereby, over a period of time, they'll get an arthritis. To reduce the arthritis or to get rid of an arthritis, it is imperative to get treated for the ligament injuries. We have a technology with the 4K camera system where we address the ligament with the reconstruction. The ligament reconstruction will be done. We take the graft from the patient's own body and reconstruct it to the place where the ligament has to be. The patient will stay only for a day, and after that we'll start with the rehabilitation exercises, which goes on increasing over a period of time until he comes to the 6 months of the time where the patient will be put on to his normal activities, where he can go to the his play or any other activities. Apart from that, the knee, the shoulder problem is the one which patients comes to regularly. It could be due to gym activities, or it could be a fall where the rotator cuff muscle can get tear. Whereas in the old people, they don't have to fall. Even without fall, they get the rotator cuff muscle tear. This is because the degenerative, that is the aging changes in the muscle and the aging changes in the bone makes the muscle to tear easily over a period of time. If the rotator cuff muscle, if it is torn, not addressed properly, this will lead into an arthritis. The one which could be saved easily may not be able to save later. So, the keyhole surgery is the one, the mantra which helps to get back to the activities normally by repairing the rotator cuff muscle. Again, I said this will be done through the keyhole surgery, and the stay of in the hospital will be overnight. Another issue which in my practice I have seen is the low back pain. This low back pain could be many reasons. The most common is because of a disc prolapse. In the young age and in the old age, the nerve which has to go in its own path will be reduced because of a stenosis, what we call the compression. The nerve will get compressed between the two bones. When this happens, they get a back pain. This back pain can be treated with medicines and therapy in the initial, but there will be a stage where the medicines will not help, the physiotherapy will not help. Now, with the latest technology, what we call endoscopic discectomy, here we do not cut the part, big one. Here hardly around 1 centimeter, less than a centimeter of the part will be cut, and a small scope goes inside the back. It goes directly to the disc where it has been coming out and pressing the nerve. That is the part only we'll be taking. This will be done many a times with the patient unconscious. So, the complication will be very less. We will be knowing where we are touching. If we are touching the nerve, we will come to know on table. So, the safety is very, very, very precise, and the complication is very less. Similarly, in the old age also, when there is a nerve passage is very much stenosed, that is, the passage will be very narrowed. This also needs an intervention. That is solved by using the endoscopy, where the stenos will be released by taking the extra tissues and muscles which is grown around the spinal canal. That gives a beautiful relief for the patient, where they can go home as a daycare procedure. They don't have to be worried with the big cuts, conventional cuts, where the patient staying in the hospital will be very long. The longevity of the hospital staying will be long, which can be reduced through endoscopy spine surgery. When it comes to sports injuries and when it comes to the spine problems, there is a solution with endoscopy for the spine and keyhole surgeries for the sports injuries. There is no longer for the people to suffer with the pain. We are here for you. We are here in AASRA Hospital, Bangalore.